I know there's a little bit of pressure, but it shouldn't really hurt. So this side over here is loose, so we get to come in underneath here. Pressure. Hey guys, it's Dr. Carter with Lexington Podiatry, and here we have something that's really common. It's called an epidermal inclusion cyst, which is really a callus with a little core. It happens a lot in pressure areas like on the ball of your foot. It happens in between the toes. This one just happens to be on one toe, it's the second toe, and it's because the big toe and the second toe are kind of friends and are a little bit too close. So let's look. So it's really difficult to see, but it's like the princess and the pea. Sometimes the tiniest little things cause the biggest issue. So here we have this little circle. It's kind of clear, but it looks like a defined core. And it's happening because the two toes are pushing up against each other in a way they shouldn't be, especially when shoes or socks are applied. So what we do for this is we trim it down. We get rid of the outer layers, and a lot of times that will expose more of the little central core that you can see. Once again, it's tiny, but it causes a significant amount of pain. So here is our little core. We're gonna kind of core it out a bit. I go around it in a couple of different directions. I don't want to make her bleed. I don't want to go that far. I just want to get as much off as I can in a safe manner so I can apply a chemical. We use an acid here called cantharone, and it's got a couple of different medications in it. The goal of it is we put it on this really hard tissue, and it helps to kind of eat it away and soften it. A lot of times it will blister underneath, and that helps her body to kick it out. Now, it's not going to be permanent. It's going to come back, and that was one of her issues this morning, was that it already came back. If she never walked again, if she never put pressure on this toe again, it would never come back, but of course that's not possible in the world we live in, and nor do we want it to be. Pending I can get the medicine open, we're going to dip a Q-tip in there. You have to be really careful putting this medicine on in between toes, because the skin in here is a lot more sensitive than it is in a lot of places. So I don't put as much as I would if it were on the bottom of the foot. All right, we're gonna be really careful not to let it touch the big toe. Tanya's gonna be a helper with the Band-Aid because it sticks to my gloves. So we're gonna wrap a Band-Aid around it, and that's all we do. Very painless, and it helps quite a bit. Beautiful. Hey guys, it's Dr. Carter here at Lexington Podiatry, and we have something that's really common in young athletes. We have some toenails here that have some ridges in them, and they're also starting to loosen over on the side. Now, there's a couple of factors here that come into play. One, this young man is in cleats all summer long because I bet he's a pretty good baseball player. Number two, the structure of his toe bends down a bit. That's called a hammer toe, where you have this enlarged knot here. When we shove him into a baseball cleat, when he's digging in and running to first base or home, his little toes are gripping the ground, and it's putting a whole lot of pressure on the tip of the toenail. That causes it to get thicker and thicker over time, and that trauma is causing some of these ridges. As it gets thicker, the pressure from the cleat will then cause it to loosen. We call this dystrophy, which is thickening. We call it a contusion, which means it's been bumped repeatedly. All of that leads to a nail that's very lytic or loose. What we do here for that is we trim away the nail that's loose. We start a softening agent on it called Repair from Mod Podge, which has an acid in it to help soften the nail and the skin underneath. And it also has an antifungal in it to help keep him from getting a fungal infection. And then we talk about laser therapy. Laser therapy is a light beam that we shine on him to help promote growth, blood flow to the area, and to repair all of this trauma that's happening and to help him fight it day in and day out. So those are the normal treatments we do. Nothing is painful at all because we don't want to hurt him. So let me show you how I'm going to cut it, and then I'll show you how I'm going to buff it down too. All right. Perfect. These look really scary, but they're not. My kids hate it when I pull them out at home. So I'm just going to trim the top of it. You tell me if it hurts, okay? I know there's a little bit of pressure, but it shouldn't really hurt. So this side over here is loose, so we get to come in underneath here. Pressure on a nail that's partially loose and partially attached actually does hurt. When he has on shoes, when somebody steps on it, sometimes even a sock pulling on it. Look, it looks pretty healthy underneath there. It's almost like he was growing one nail over top of another one. And I know a lot of you feel that you get that. Most of the time it isn't true, but I think he actually has a whole new nail under there. You don't have two heads, you have two toenails. There we go. So some of this is still pretty attached, and if I try to trim it, it's not gonna make him very happy and it's gonna bleed, and we're trying not to do that. So I'm trimming all of the loose, and then I'm gonna buff the rest of it down. Does that hurt? Oh, look, it just broke loose. Just a little coercing. You still doing okay, bud?
Yeah.
Okay. That was the cutest answer ever. Okay, if I take it further, I know it's gonna hurt him. So we're gonna use the buffer now and see if I can't just thin it down. It may vibrate a little bit, it may tickle. If it gets hot, you let me know. That is not supposed to happen. Sometimes it's brittle and little pieces will fly. So far, so good though. You doing good still?
Yeah.
Okay. Sometimes we can't get it completely smooth, which is okay. As long as I reduce all of the loose parts, then I put him, he's not at risk anymore of ripping it off. That's what I really don't want to happen. And I also don't want more trauma to occur than has to. Okay, it almost looks more normal. It's a little loose there, but I think we're good. Perfect. Just like a pretty normal nail. All right, guys, see, he didn't scream at all. So when you have toenail issues, we can usually fix your problem without any pain. We don't always have to do shots. We're not trying to torture you. So come in and let us take a look. Have a great day. Hey guys, it's Dr. Carter here at Lexington Podiatry, and we have something pretty common on the foot that happens a little bit more in the wintertime, but can happen in the summer as well. Let's take a look. There is some dry skin on this gentleman's foot, and it's mainly around this rim or around this edge. That tends to happen a lot from pressure. He stands on his feet a lot, he chases his kids around, and most of us know how that goes. So putting a lot of pressure here in the center of the heel forces additional pressure out, and the skin will break and crack. Now, he's not at that point yet. There are no fissures or cracks or breaks in the skin, which is great, and that's what we want to try to prevent. However, some of this dryness in here is getting to the point that it could pretty easily crack, and we're going to try to knock that out of the woods today. So first steps here when you come in are we're going to buff it. We're going to try to buff it with a grinder that doesn't sound like that. So, all right. So what we do is we start by gently filing. Sometimes the skin is not as thick as it looks, and so we have to be careful. This grinder spins so fast it can actually burn people. Yep. I don't even know how to fix that part. So, Ash, any ideas? Or grab me another one. Okay, let's try it again. Okay. So we're gonna just keep buffing little by little, making sure that we don't burn him. Good news is the skin on the bottom of the foot, especially the heel, is really, really thick. And so that's gonna be good for us. We can go a little bit further. Can I have that gauze? All right, thank you, ma'am. So, I'm so sorry. Look, it already looks so much better. You don't really see the scaling. You don't see a lot of the dry, cracked skin just by getting rid of those outer layers. And this is gonna be really helpful to do a couple times a week for sure. Now, I don't want him taking a grinder to it, but he can use a pumice stone or an emery board or one of those sanding rocks. Cheese graters, those are definitely not my favorite, especially with someone with neuropathy or diabetes, because they can be pretty aggressive. But a lot of people do use them. And our goal here is not to get rid of every single bit of this. It's just to get rid of the outer layers so that way our treatment can work. All right, so that looks pretty good. So our treatment for this is going to be a lotion with an acid in it. Here at the office, we use something called Mod Pod Heal, and it looks like a deodorant stick, and you can rub it all the way around the outer edges, and it is a balm. It is a really thick lotion with an acid in it, and the acid isn't strong enough to hurt him, but it has exfoliating properties, so it's going to help to eat away and soften that tissue so he can get more off. We also use Mod Pod Scrub, which is an exfoliator. So when he's in the shower, he's going to take this salt scrub and he's going to rub it all over his feet to try to get rid of all the stuff that we've softened. Those two things every single day should help to keep this from cracking and becoming a problem, specifically in the winter like we talked about. Everything is geared at no cracks in your feet, which can lead to infections and amputations, which we definitely don't want that to happen. So if your heels look like this, if you've got cracks, if you've got calluses, big thick spots on your skin, we can help. We've got lots of products here. We've got the know how to do it, so let us know, okay? Thanks for watching. Have a great day.